All right. So good morning, everyone. I'm Michelle Sandsmark, and I'm in the Masters of Public Health program. I completed my practicum with BC Healthy Community Society, located here in Victoria. And during my practicum, I composed success stories for their new program website titled PlanH. These stories highlighted local governments' healthy community initiatives, and using the 5 building blocks of the healthy communities approach as my framework, I analyzed these stories to identify the key factors for success. The purpose of this analysis was to provide insight to the PlanH program team so they may be able to provide better support to communities and address any gaps identified. So just a bit of background, BC Healthy Communities is a nonprofit society that provides multiple resources and learning opportunities to organizations throughout BC to help improve the health and well-being of British Columbians. BC Healthy Communities is based on the foundation of the Healthy Communities approach, which encompasses 5 building blocks seen here: healthy public policy, community engagement, political commitment, multi-sectoral collaboration, and asset-based community development. In 2012, Healthy Families BC and BC Healthy Communities consulted with local governments across BC to hear about the supports that they need to improve community health promotion. In response to this feedback, the PlanH program was developed to provide the supports that local governments need to make health a top priority. As you can see, there are 3 overarching focus areas: healthy people, healthy society, and healthy environments, which is kind of washed out, sorry about that. And each encompass a number of subcategories. These are the target areas of the PlanH program. And, and embedded within this is the Healthy Communities approach. Now, every community is unique, and there are a ton of local government healthy community initiatives already taking place. These deserve to be celebrated and recognized, and the PlanH website was just the platform for doing this. Sharing these stories may inspire others to imply similar ideas in their own communities. So what are the keys to success? I wanted to deconstruct these stories to find the underpinning keys to success aligning with the 5 building blocks of the Healthy Communities approach. This is important so the PlanH team may be able to better assist local governments in their efforts. The methodology I undertook was fairly straightforward. My sample or list of success stories to profile was obtained through 2 sampling techniques. First was a convenience sample. A database was created by a previous consultant which summarized 227 local government healthy community initiatives throughout the province. I shortlisted 47 of these based on year and availability of information on the internet. And second was a snowball sample. I asked key people for story leads, and 2 more were collected. Out of a total of 49 potential stories, I pursued 18, and a total of 13 were included in this analysis. The 5 building blocks provided the framework for this analysis. After composing the story, I hand-coded each one to identify common themes associated with each of the building blocks. The themes that arose have helped me to determine the ways in which local governments are supporting or are not supporting each of the building blocks. And my results turned up some really interesting key factors for success. Under political commitment, local governments expressed that it was extremely important to involve elected officials. When elected officials were connected to the heart of an issue in a community, rapid progress was made to address these concerns. An especially strong example of this was seen in New Westminster, which is in this picture right here. For their wheelability assessment, city staff coordinated these assessment days to ensure elected officials could participate and would participate. Staff from different local governments would mention that this provided an opportunity to have meaningful discussions with affected community members, leaving a powerful impression on political leaders and putting bottom-up pressure on them to address these health inequities and lead to positive change. Under multi-sectoral collaboration, 11 of the 13 stories included in this analysis demonstrated interdepartmental collaboration and cross-sectoral action. Informants from Revelstoke and New Westminster specifically stated that breaking silos and developing partnerships was a key component to their success. By breaking silos, they were able to optimize resources, information, and capacity to share the workload of a project. Vertical integration was seen in some of the stories, but I found that collaboration between the different levels of government needs to be strengthened. Providing funding, toolkits, and other information to local governments from the top down appeared to be the form that partnership would take. While funding and information is undoubtedly needed from the top, this runs the risk of reinforcing that top-down relationship, which may not be an effective or sustainable form of partnership. Under community engagement, I found that they needed to create opportunities for meaningful community engagement. It's one thing to hold a public forum for which residents can attend and maybe voice their opinion, but to have an ongoing process in which local governments were continuously engaging and interacting with community members was much more beneficial. This can result in strong community leadership that has the potential to mobilize healthy public policy. In the development of the Vancouver Food Strategy, the City of Vancouver conducted a public engagement process that took place over 18 months and reached out to 2,200 people. A number of activities took place, which you can read here, and this helped the city to gather a breadth of insight about the community's needs, raise awareness, and generate discussion about the initiative, especially amongst populations that are difficult to reach. After conducting the public engagement process, local governments who were successful would listen intently to the public and translate this knowledge into action. Under asset-based community development, it's all about the people. Local governments can tap into the people potential within a community to implement sustainable solutions that address health issues affecting their citizens. One incredible example of this was seen in New Westminster. There was a need for a youth center, so the youth center at Moody Park Fundraising Committee created a goal of raising $200,000. This would pay for some of the costs of the youth center. Local individuals, service clubs, and third-party fundraising events took place to contribute to this campaign, while a senior citizen of New Westminster nominated the Youth Centre for a 24-hour voting contest hosted by Craft Canada and TSN, in which they won $25,000. In 6 of the stories, at least one person was highlighted as the community champion or social entrepreneur who helped propel an idea into action. The future of health promotion depends on these social entrepreneurs as they seek innovative solutions to address the social determinants of health in their community. Under healthy public policy, again, it's back to the people. Collaboration is essential for policy decisions and implementation. Collaborative action for policymaking was seen in 7 of the analyzed stories. Collaboration between local government and provincial government and organizations locally helped to generate the resources and capacity needed to create healthy public policy. I found that there appears to be a need to support evidence-informed policymaking. Some communities appeared to just follow the lead of other communities or just implement a policy perhaps because the province suggested or generalized that it was a good idea. But it was unclear whether or not an analysis of the broader literature was consulted to seek out whether or not there were other options that were better for their community. This brings me to my final discussion and conclusion. While all of these pieces I mentioned previously are keys to success, I noted that the PlanH team may be able to provide further support in future in the following 4 areas. First, to prevent implementing ineffective policy, it may be beneficial to provide learning opportunities or resources that will assist decision makers seek evidence for policy development. One of the BC Healthy Communities employees stated that it may be helpful to host a webinar about how to use or to search for the literature and data and how to use it. And though it appears to be improving, collaboration between local governments and the health authorities needs to be strengthened. I feel that bridging this gap is one way to get health on the agenda of local governments who may not already have this health lens at the forefront of their minds. In 2012, the Healthy Families BC Communities program was developed, which aims to connect local governments with their health authorities. The PlanH team can promote this partnership by becoming a hub for which local governments and health authorities can connect and possibly encourage them to sign a partnership agreement. As mentioned, a major determinant of success was if elected officials were connected to the heart of an issue. which PlanH can continue to encourage. This provides opportunity for meaningful community engagement and for the voices of community members to be heard. Overall, it was clear that collaboration and involvement from the grassroots up was the key ingredient for local governments to succeed in implementing their initiative. PlanH currently stimulates opportunities for capacity building through funding and learning opportunities and should by all means continue to do so. That concludes my presentation. Thank you all for listening, and thank you.
So, questions for Michelle? Come on, there's got to be at least one. You've all had coffee. No? There's one. Okay, good.
Yeah, thanks, Catherine. Thank you. Oh, sorry.
You go for it.
Oh.
Sorry, Michelle.
That's okay.
I really loved your presentation, first of all. I guess that's not a question. My question is, in the section where you described the importance of getting elected officials involved, did your project uncover any advice for how to get those officials involved? Because from my own experience, public officials seem to be, too busy for public health initiatives, so on and so forth. So if you have any advice, love to hear it.
So how to get elected officials involved? I think from what I was seeing, it was city staff who were really reaching out to their elected officials and ensuring that they were coordinating specific days to actually be able to involve them and get them connected to people. I wasn't really on the ground level kind of doing this thing, and I mean, it's something definitely to consider for the future. I'd also like to know, because it seems to be an issue that a lot of cities or districts face. But yeah, thank you for your question.